Welcome to Nursing School.
Welcome to Nursing School.
The skeletal system. Parts of the skeletal system. 1. Bones, skeleton. 2. Joints, is connection of bone. The joint is sift into different types which are movable like synovial joint and immovable like suture which connect together the cranial bone. 3. Cartilages, is elastic fiber which cover end of long bone. 4. Ligaments is connective tissues which connect bone to bone and tendon is connective tissues which connect bone to muscle. Skeleton system is divided into 2 divisions. A. Axial skeleton is divided into 3 parts which are skull, vertebral column, and bony thorax. B. Appendicular skeleton is made of upper and lower limbs and girdle which are shoulder girdle and pelvic girdle. Functions of bones. 1. Support of the body. 2. Protection of soft organs. 3. Movement due to attached skeletal muscles. 4. Storage of minerals and fats. 5. Blood cell formation. Bones of the human body are made skeleton system. The skeleton has 206 bones. 2 basic types of bone tissue. I. Compact bone are homogeneous. 2. Spongy bone are small needle-like pieces of bone has many open spaces. Classification of bones. Long bones are typically longer than wide, have a shaft with heads at both ends and contain mostly compact bone. Examples: femur, humerus. Short bones are generally cube-shaped, contain mostly spongy bone. Examples: carpals, tarsals. Flat bones are thin and flattened, usually curved thin layers of compact bone around a layer of spongy bone. Examples: skull, ribs, sternum. Irregular bones are irregular in shape and do not fit into other bone classification categories. Example: vertebrae and hip. Bone growth take place on epiphyseal plates. Epiphyseal plates allow for growth of long bone during childhood and new cartilage is continuously formed while older cartilage becomes ossified. Remaining cartilage is broken down and the bone replaces cartilage. Bones are remodeled and lengthened until growth stops. Bones change shape, some bones grow in width. Types of bone cells. Osteocytes is responsible for maturation of bone cells. Osteoblasts, it is responsible on bone-forming cells. Osteoclasts is responsible in bone-destroying cells. Break down bone matrix for remodeling and release of calcium. Bone remodeling is a process by both osteoblasts and osteoclasts. Bone fractures is a break in a bone. Types of bone fractures. Closed, simple, fracture is break that does not penetrate the skin. Open, compound, fracture is broken bone penetrates through the skin. Bone fractures are treated by reduction and immobilization. Realignment of the bone. Fractures are also categorized based on the shape of the break. There are 8 main shapes or kinds of bone fractures. Transverse fractures, go more or less straight across the bone. Oblique fractures, are diagonal breaks across the bone. Spiral fractures, happen when one or both halves of the bone are twisted. Comminuted fractures, break the bone into more than 2 pieces. Avulsion fractures, mean pieces of the bone have been pulled apart. Impacted fractures, are the opposite of avulsion fractures. These happen when a piece of bone is pushed down into another piece of bone. Fissure fractures, are cracks in the bone. Green stick fractures, happen when the bone bends and breaks partially, but not completely. Transverse fractures, go more or less straight across the bone. Oblique fractures, are diagonal breaks across the bone. Spiral fractures, happen when one or both halves of the bone are twisted. Comminuted fractures, break the bone into more than 2 pieces. Avulsion fractures, mean pieces of the bone have been pulled apart. Impacted fractures, are the opposite of avulsion fractures. These happen when a piece of bone is pushed down into another piece of bone. Fissure fractures, are cracks in the bone. Green stick fractures, happen when the bone bends and breaks partially, but not completely. Repair of bone fractures. Hematoma, blood-filled swelling, is formed. Break is splinted by fibrocartilage to form a callus. Fibrocartilage callus is replaced by a bony callus. Bony callus is remodeled to form a permanent patch. Stages in the healing of a bone. There are 4 stages in process of bone fracture healing, which are: 1. Hematoma formation. When a bone is fractured, the surrounding blood vessels become damaged, resulting in bleeding within the injured area. This blood coagulates and forms a hematoma, which is the first step in the healing process. 2. Fibrocartilage callus formation. Over time, the hematoma is replaced by a soft tissue called the fibrocartilage callus. This callus is composed of collagen and cells that produce cartilage. 3. Bone callus formation. The fibrocartilage callus is gradually replaced by a bone callus, which is a hard, bony tissue that forms around the fracture site. The bone callus is made up of blood vessels, cells that produce bone, and cells that break down and remodel bone. 4. Bone remodeling. The final stage of bone healing is bone remodeling, in which the bone callus is gradually reshaped and remodeled into mature bone. This process involves the removal of excess or damaged bone tissue, and the deposition of new bone tissue. The newly formed bone tissue is usually stronger and more resilient than the original bone. Before I leave, let tell you that the bone that are not articulate with other is known as hyoid bone, and 3 smallest bone in the body is malleus, incus and stapes. In our next video I will show you 12 facial bone and an 8 cranial bone and the name of sutures or joint that are present in the head.